Hello, everyone. My name is Amit Kumar. I'm an assistant professor at College of Health and Human Services in the Northern Arizona University. Today, I'm going to talk about disparities in COVID-19 mortality in the US nursing homes. This is part of a manuscript which will be published in JAMDA in coming month. So as we know, the COVID-19 pandemic is opening a Pandora box of inequalities in our community, hospital and nursing home in the US, highlighting the widespread issue of disparities in quality of care and social injustice in our society. During this pandemic, COVID-19 related deaths in the US have been excessively high among Blacks and Hispanic communities compared to white individuals. Also, COVID-19 has disproportionately affected older people residing in skilled nursing facilities. Few initial studies have reported that almost 40% of COVID-19 related deaths happen in the US nursing homes. Although the impact of COVID-19 on nursing home was immediately evident, there was no information or federal requirement for nursing homes to report COVID-19 cases and deaths until May 2020. And some states opted not to publicly report this information, leading to a knowledge gap for patient, family, and policymaker for initial intervention during the early phase of pandemic. So we decided to examine COVID-19 mortality rates in 11,700 nursing homes using CMS nursing home data from June 1st, 2020 to December 27, 2020. In this longitudinal study, we'll link the CMS public use file with CMS nursing home compare data and long-term care facts and US county level data on COVID cases and deaths published by New York Times. Also in this study, we adjusted for the other risk factors, both from the facility and communities associated with COVID-19 death, such as age of resident, nursing home star ratings, nursing home size, profit versus non-profit, shortage of nursing home staff, supply of surgical masks and gowns, rural versus urban. Since COVID-19 is entering into nursing home from communities, so we also accounted for community county level deaths. We did longitudinal data analysis using mixed model. And our primary independent variable was proportion of minority residents in nursing home and its association with mortality rate over time. So out of the 11,700 nursing home, almost 6.8% nursing homes were categorized in a high proportion of Black residents and 7% nursing homes were categorized in high proportion of Hispanic residents. As you can see in this graph, the red line represent with high proportion of Hispanic, green line represent with high proportion of whites, blue line represent with high proportion of Blacks. So after accounting for facility and community level covariates, we found that at the beginning of our study period, nursing homes with high proportion of Blacks and Hispanic had significantly higher COVID-19 mortality rates per 1,000 nursing home residents compared to nursing home with majority of white residents. As we move forward in the mid of November onwards, there was a shift in